Pregnancy is an exciting moment in life, and for expectant mothers, it can also bring questions about how to keep yourself and your baby healthy. Maternal vaccines not only help protect you from severe disease, but they also help your body create immunity that's passed on to your baby. Here to talk about vaccines during pregnancy is Dr. Naima Joseph, a maternal fetal medicine specialist who works with the Society for Maternal Fetal Medicine.
Yeah, thank you. So as you mentioned, I'm a maternal fetal medicine, which is just fancy for high-risk pregnancy doctor. And in my practice, it's my job to make sure that every pregnancy has a healthy start, and vaccines play an important role for that. I tell my patients that, vaccines provide this two for the price of one benefit, especially with the respiratory vaccines, because we know that those infections do pose a really high risk to moms during their pregnancy. So that way the baby is born with protection, and it protects the baby from also having complications during those really vulnerable first 6 months of life.
Are there particular vaccines that you recommend and why?
Yeah. So currently it's recommended that pregnant people stay up to date with their COVID vaccines, their flu vaccines, as well as RSV vaccine if they have not received it in a previous pregnancy. And additionally, we recommend the pertussis vaccine during the third trimester. And that's because these infections have been shown to cause higher risk of complications during the pregnancy, but also infants are incredibly vulnerable to these pathogens, and we know that vaccination protects the infants.
You mentioned getting vaccines in the third trimester, but is there a particular time of year that maybe they're more beneficial? And the obvious question for a lot of people is, are they safe?
Yeah. So the COVID and the flu vaccine, as well as RSV, are what we call seasonal vaccines. So they're recommended to be given during respiratory viral season, which is fall to winter. Pertussis is year round, and so that can be given anytime the person's in their third trimester. What I tell pregnant women is that really, as soon as you're eligible to get your vaccine, you should get it. There's no trimester specific timing for COVID and flu because those vaccines really work to protect you from infection. And we have lots and lots and lots of information from clinical trials, from observational studies, from surveillance networks in the United States and internationally that tell us that these vaccines are safe.
A lot of information here. Maybe hard to digest it all at once. Is there a place that viewers can go and get more information, learn a little bit more about what we're talking about?
Sure. So as you mentioned, I work with the Society for Maternal Fetal Medicine, and people are welcome to go to our website, highriskpregnancyinfo.org, and in order to get more information.
Fantastic. Great information. Dr. Naima Joseph, thank you so much for being on Coast to Coast.
Thank you so much for having me.